artificial intelligence n'enkora y'amagezi gahiguru erikutebwa mu computer etekatandika kukora no kuteekateeka nk'omuntu. Dr. Simon Arunga omushaho wa misho ahirwarira ihangwe rya misho rya Mbarara nagira ngu enkora egi okuza kukora ni Gavumenti yatamwa amaani mingi omu kubahereza sente na internet etakurugaho.
If it is properly harnessed, it has capacity to provide solution across many areas in healthcare, not just in eye health, but all diseases, in cancer, in chronic non-communicable diseases. And really, the government needs to take lead and not take the back seat in this technology.
The first is that we need to invest in data collection. The artificial intelligence tools that are being deployed now are trained on data coming from high-income countries from the global north.
One of the biggest challenges that innovators face present day in Uganda is the fact that for us to really improve, we need to take a step towards getting internet better. And if we are doing the same thing, then we are lagging behind and the world is moving quickly.
Professor Celestine Obua omuhezi wa mukuru w'itendekero lya MAS nagira ngu abejo baza kuganyurwa mu nkora egi na munonga bari kushoma obushaho nk'itendekero bine kutaha emishomo erukukwata artificial intelligence.
For us to be able to bring our students on board to utilize artificial intelligence, we need to design courses that guides them towards using either machine learning or artificial intelligence.
I believe that with artificial intelligence, with data science, it is such a field that is going to help even us as doctors easily give care to the population, but even the population to easily access information.
Omugandi Lieutenant Joe Warusimbi RDC wa Kasese arabwira Abashaho omu district egi okurugaha muze gokosha aha murimo gurumuntu gweyongera omu marwariro ga district ya Kasese. Ebi yabigambira wabe natongoza hirwariro rya Kabatunda Health Center 3 n'okukuza irwariro rya Bwesumbi Health Center 2 okuza rurengo rwa Health Center 3 gona gari kushangwa muri Busongora North omu district ya Kasese.
So my humble request to the health workers to serve their expectations, because they have been lacking something, but now drugs are there, everything is there, and they are even posted more staff to enforce the facility.
This building was affected by ADF and earthquake in the 90s. So when I came here, you see, it's the only health center 3 which was in these hills. Our neighboring health center 3 is very far Kichwamba, so we had a lot of deliveries and we were improvising using a staff house.
Facility was a health center 2. We could not even offer the services as we are offering right now of a level of health center 3. So before it was only OPD, but today it is now an integrated health service delivery.
Elfazu Muhindi ori chairman LC5 district ya Kasese nagira ngu obwahato buhereza bwamazire kuba n'ubuhika hihi n'abantu.
We are now going to construct a staff quarter. We already have over 100 million. Now that we have 25 million, which was meant to renovate the previous OPD that was there, we are going to add it on that and to make sure we construct a twin staff house.
Ebyo na maziro sente ziri kurenga miliyoni 83 omu za Uganda. Abwa TV West and Adolf Ayureka na Gilbert Muhanguzi.